I think one of the most troubling, a lot of things troubling about this coronavirus epidemic, but I think some of the most gut-wrenching things are when I hear from families who have someone in a nursing home who are not able to visit with them. We put the order in when we started this to try to save lives in our nursing homes. Cutting down on visits, cutting down on people going into the nursing homes. My job as governor is to do everything I can to protect the most vulnerable among us. Part of that job means putting measures in place to keep people safe from the virus. It also, though, means protecting those things that add value to life. And visits by family members to nursing homes, to their loved ones, is certainly something that adds value to life. And I know that this has been gut-wrenching for families not to be able to see in person their loved one. In March, as you know, we put in place an order to restrict visitation to essential personnel in nursing homes, assisted living facilities, intermediate care facilities for individuals with intellectual disabilities, and with an exception for end-of-life circumstances. And by the way, just let me mention that that exception for end-of-life circumstances has been broadened, and people should take a look at that. But we realize that the lack of in-person engagement with family and friends who live outside of these congregate settings may significantly diminish a person's quality of life who is in one of these facilities, making visits necessary to address the person's emotional wellness while safely managing potential physical health risk. On June 8th, assisted living and intermediate care facilities were permitted to facilitate outdoor visitation. And I know I've talked to people who are visiting their family members, and I look forward to going to see shortly. Fran and I do our friend Fred, who is in a facility, assisted living facility in Greene County. Today, we are announcing the beginning July 20th. Nursing homes are permitted to begin outdoor visitation so long as all safety standards are met. When assessing their readiness to permit outdoor visitation, nursing homes should consider the number of COVID cases in the community, the case status in the nursing home itself, staffing levels, access to adequate testing for residents and staff, personal protection equipment supplies, and local hospital capacity. Now, having said that, it is our goal to have people be able to visit their family in nursing homes across the state of Ohio. And we know that these nursing homes have to have a little time to get ready for that. But we would hope that they will start doing that. I know some of them have already done it. The assisted living has worked out, we think, pretty well as far as we can tell. And now we want to extend this to the nursing homes. We are in the process, and we'll discuss this with General Harris, but we are in the process of testing every nursing home. And the General and the National Guard are making progress. I know some nursing homes are providing their own testing. Our long-term goal is to test every facility and then have the staff continue to be tested. And we're working with the nursing homes to make sure that happens. So as far as the visitation, once the nursing home has been cleared, once the testing has been taken place, then that nursing home can, in fact, start opening up for visitation. Again, subject to the basic standards that we outline. Let me just talk for a moment about this decision. And again, some of the things that we did. We looked at the impact on the quality of life a prolonged loss of connection can have on an individual. We looked at requests and listened to requests from families and residents. We looked at and consulted with advocates and providers in the aging and developmental disabilities communities. We looked at guidelines for visitation jointly developed by the Academy for Senior Health Sciences, Leading Age Ohio, the Ohio Assisted Living Association, the Ohio Healthcare Association, and the Ohio Medical Directors Association. We're confident that our approach provides each facility the flexibility needed to access their readiness to safely facilitate outdoor visitation, and to do so in a transparent way that keeps residents and families informed. The order and related guidance will be made available at coronavirus.ohio.gov. And should you have any questions after visiting your loved ones, you can always contact the State Long-Term Care Ombudsman, an office within the Ohio Department of Aging, at 1-800-282-1206.